Now, I've tried to explain it detail that concept of osmolarity because it's a bit tricky. So if your all the queries are clear, we will move to another topic that one of the student also mentioned in the group. All right. Next, moving towards our the acidosis, and it's a very high yield too. Normally, we know that our body pH is 7.4. And we have two conditions, either a metabolic and the respiratory. The metabolic is associated with bicarbonate. And we know that our normal value of bicarbonate is 24. So whenever our body bicarbonates get down, body goes into metabolic acidosis. And whenever bicarbonate increases from 24, body get into the metabolic alkalosis. Respiratory is all associated with the partial pressure of carbon dioxide. Whenever the normal value is 40, whenever the partial pressure of carbon dioxide is increased above 40, like 60, it's the respiratory acidosis. And whenever the partial pressure of carbon dioxide is decreased, hyperventilation, it's respiratory alkalosis. Now see what happened in the metabolic acidosis. You have the pH less than 7.4. And the main pathology in case of the metabolic, I would say, is the bicarbonate. So always remember that the student get confused because in the scenario, they will expecting that if one bicarbonate is changed, then metabolic, there is the partial pressure of carbon dioxide value would be normal. No, always remember whenever there is a metabolic, body have within like very speedily compensatory response. So in compensation, your carbon dioxide value also changes. So whenever you will say that the pH is decreased, always go see whether the bicarbonate is low or not. If the bicarbonate is low, always go for the case of the metabolic acidosis. What will happen that whenever the body have acidotic condition, it will try to hyperventilate. So in order to release that excess carbon dioxide from the body. So in response of hyperventilation, your partial pressure of carbon dioxide decreases from the 40. Less than 40, they will give either the 26 or the 30, that one. And it's the problem with diabetic ketoacidosis. I will explain you how diabetic ketoacidosis results in metabolic acidosis. First, only just know the values. However, metabolic alkalosis, again, the pathology will be bicarbonate that is greater than the 24, pH is greater than the 7.4, and metabolic alkalosis, what will your compensatory response is that increase in the partial pressure of carbon dioxide. And it's an example in the vomiting because in vomiting, you lose the solute that is bicarbonate. In respiratory acidosis, again, your pH is less than 7.4. And here, whenever the respiratory, the pathology is in partial pressure of carbon dioxide. Partial pressure of carbon dioxide is increased like greater than the 40. Like in case of COPD, there is an obstruction of outflow tract. Your oxygen can't get in, carbon dioxide can't move out, it get trapped. Whenever trapped, partial pressure of carbon dioxide increased. So in response to that, pH get decreased and our body has compensatory. But always remember, whenever there is a metabolic state, the respiratory condition occur within a minute. Respiratory compensation is minute. However, in case of respiratory acidosis, there is a renal compensation, like the kidney have either reabsorb or like excrete the bicarbonate, so it's a delayed compensation in case of respiratory cases. So respiratory acidosis, example in COPD, what will happen in response to compensatory response, your body will try to reabsorb more and more bicarbonate. So bicarbonate level is increased. In respiratory alkalosis, there is the increase pH greater than 7.4, and again the pathology is that your partial pressure of carbon dioxide is less than 40, example in the hyperventilation, and what will happen in compensatory response, your body will lose the bicarbonate and bicarbonate value is low. Now, these I have seen that in the first stage, you will see a lot of, like they have given you an example, a lot that the person get even confused. But I have done all the BME forms, and trust me, that four condition which I have listed, only these are tested. No another like glycol, lactate, methanol. I have never seen that that concept of acidosis, alkalosis with that. They have all about diabetes, vomiting, diarrhea, and altitude sickness. So these are both, I think, the top high yield conditions. So, metabolic acidosis in diabetes, you know that condition to which I have mentioned and remember it very well. Diabetes, ketoacidosis, kidney failure, because in kidney failure, your like hydrogen are not going, your organic acids are not going to secrete from the body. So, what will happen? Your acid buildup and metabolic acidosis. Again, in the diarrhea, why in diarrhea there are loss of the bases like bicarbonate, that's why acidosis, and causal mole due to hyperventilation. In metabolic alkalosis is due to the vomiting and volume depletion. Respiratory acidosis, as the body is COPD condition, opioid and hypoventilation. In COPD, body get trapped, partial pressure of carbon dioxide, carbon dioxide, partial pressure get increased, and in result respiratory acidosis. And respiratory alkalosis is associated with very, very high yield condition, altitude sickness. I will explain you. Now, how diabetes ketoacidosis causes metabolic acidosis? Actually, you know that there is a formation of type 1 diabetes mellitus ketones, and ketones is actually an inorganic acid. So you would say that apart from a normal, there is an excess more acid that is being produced by your body. So what will happen in order to buffer that acid, concentration of your bicarbonate get decreases. So whenever we know that the bicarbonate decreases, there is a condition of metabolic acidosis. There is within the minute compensatory response, and compensatory response is that our body tries to get off excess partial pressure of carbon dioxide, and patient is hyperventilating, which result in the causal mole breathing, that is high yield condition associated with diabetic ketoacidosis patient. So your partial pressure of carbon dioxide decreases because of hyperventilation. A very, very high yield. Always remember that there is an increase anion gap. Remember, simple, like I have seen most of the people, even myself, get confused that isn't it's the case of the anion gap increase or not. So there is a simply trick. Whenever you would see that there is some production of an acid, always go for anion gap increased. Like in that case, there is a production of ketone that is an organic acid. Example, increase anion gap you would see in mention in first aid is the glycol. In glycol, increase in the ethylene glycol. Moreover, example in the D-lactate, you have an increase anion gap metabolic acidosis. Why? Again, the reason is lactic acidosis. In kidney failure, your body is not going to secrete that acid. So always remember, when apart from the hydrogen, there is another exogenous source of the acid, always go for increase anion gap, because that is very, very tested on your UWorld. And I will explain you that in diarrhea, what will happen? In diarrhea, there is no another exogenous source of any acid in your body. What the main pathology is, your bicarbonate is getting loose. So that loss of bicarbonate results in the metabolic acidosis. However, within the minute, your chloride increases in order to restore that loss of bicarbonate. So diarrhea is there is also hygiene condition that diarrhea is associated with hyperchloremic metabolic acidosis because chloride increases so that the anion gap wouldn't be affected. That is the reason in diarrhea there is a normal anion gap. Again, you don't have the time to think for a broader view. Just remember that trick. If there is any exogenous source of the acid, must remember that anion gap is increased. However, if there is pathology with your bicarbonate, your hydrogen or chloride, always remember it's a normal case, normal anion gap. What will happen into vomiting? In vomiting, you are losing your HCl. So excess HCl is lost. What will happen now? There is hydrogen that is lost. In result, bicarbonate is increased. Increased bicarbonate due to the hydrogen loss. So what will result in that? There is the contraction metabolic alkalosis. How bicarbonate is increased? Because that bicarbonate is buffering your hydrogen. So whenever there is no hydrogen or less hydrogen, bicarbonate are not consumed in buffering. It's like remained in as their form bicarbonate. So that is the reason bicarbonate increases, and we know that whenever there is a bicarbonate increases, so pH increases, and that is the condition of metabolic alkalosis. Compensatory response is the partial pressure of carbon dioxide increase, hyperventilate our bodies so that excess carbon dioxide will get off from your body, and your urine chloride is very low. That is a high yield point. That is the two condition. In vomitus, your chloride is increased because it is lost in vomiting. However, in urine, your chloride is low. So that point two, I see that the student also get confused. So always remember, in vomiting, your urine chloride is low. And lastly, in the altitude sickness, a very, very high yield condition, whenever the person ascends, and there is a hypoxemia. What will happen in hypoxemia? Body try to ventilate. There is a hyperventilation. In result of the hyperventilation, your partial pressure of the carbon dioxide decreases. So whenever there is low carbon dioxide, we know that the pathology is alkalosis. So the body have respiratory alkalosis. So what will happen? There is a renal loss, that is a delayed response of bicarbonate, so the level decreases. And that is the reason how altitude sickness results in respiratory alkalosis, all because of the hyperventilation and decreased partial pressure of carbon dioxide.